So this is our week 12 PPA presentation, and this is done by Ben, Andrew, Mary, Million, and Molly. So we're doing the shoe height, upper prevention, and ankle sprains in basketballers. An ankle sprain is one of the most common injuries in sport and can be defined as the overstretching or tearing of the ankle ligaments. The injury itself is obtained through rolling, twisting, or turning the ankle joint in an unusual manner. There are two types of ankle sprains, lateral and medial. However, lateral ankle sprains are more common. An ankle sprain can be placed into one of three grades. The first, a mild ankle sprain, will usually heal within 2 to 3 weeks. The second, a moderate ankle sprain, will require approximately 4 to 6 weeks to repair itself. A grade 3 ankle sprain normally takes 6 to 12 weeks to heal. More severe ankle sprains can result in a complete rupturing of the ligaments as well as fractures of bones. The proposed changes involve 622 basketballers to wear different types of basketball shoes to observe whether the structure of the shoe reduces the likelihood of an ankle sprain occurring. The participants are only allowed to wear the shoes during competition, and a total of 3 different basketball shoes were offered. The first was a standard high top basketball shoe. The second was a high top basketball shoe with inflatable air chambers. Finally, the third pair of basketball shoes were a standard low top.
For our presentation, we developed a PICO mnemonic to evaluate an answerable related question. Our population being basketball players with ankle injuries over the past. Our intervention being high top shoes with inflatable air chambers and low top shoes. Our comparison was if footwear plays a role in the prevention of ankle sprains, and our outcome was reducing ankle sprains and injury. Our practice-related question, based on the PICO mnemonic, is does the high top shoe, the upper, prevent ankle injuries over the low top shoe? In relation to the chosen article, it is relevant and specific to address this issue that the high top shoe reduces ankle sprain injury than the low top shoe. Following our practice-related question, we identified multiple articles from the TRIP database. Our search strategy we initiated were basketball players, high top, and prevent, and also ankle sprain. In our search strategy, we adopted specific truncations to certain keywords. By adopting the truncation on prevent at the end of the word, indicates that the search strategy will be more broader to include words such as prevention and preventing, which ensures that it is an accurate study for our research. The article we found was from TRIP database, which received 15 results. In order to choose the most relevant and specific article in relation to our practice-related research question, a screening process was considered to find the most effective article. The article we selected was a randomized controlled trial by Barrett et al., as it was the highest level of evidence in terms of the CEBM level of evidence.
Using PEDRO, a critical appraisal of the intervention study was conducted. So there was eligibility criteria that was specified. The inclusion criteria involved eligible participants who were basketball players with a previous history of ankle sprains. Exclusion criteria were individuals with a history of ankle sprains, ankle fractures, knee injuries, foot injuries, exercise habits, and subject ankle instability. There was random allocation. All the basketballers were randomized using a standard table and were all provided and fitted with a new pair of basketball shoes into 3 groups: low top shoes, high top standard shoes, and high top shoes with inflatable air chambers. There was no concealed allocation. The allocation occurred through a randomized table. However, the procedure did not mention whether it was concealed or not, and therefore we did not believe this criteria was satisfied. There was no baseline comparability. A baseline was not established at the beginning of the study. Although the participants completed a physical examination, a baseline was not mentioned, meaning that there was nothing that they could statistically compare to in the completion of the study. There was no blind subjects, therapists, or assessors. There was no explicit mention of whether the participants, therapists, or the assessors were blinded. This means that it was likely that the participants could distinguish between the 3 types of sneakers, and because they checked their shoes in and out before and after the games with designated monitor, it's possible that the assessors accessed these records as no clear guidelines were set to blinding. There was adequate follow-up of the 622 participants, with only 15 players experienced an ankle sprain in the 2 months, 7 being high top shoes, 4 in low top shoes, and 4 in high top shoes with inflatable air chambers. These players were contacted by telephone to confirm and follow up their injuries. There was no intention to treat analysis. There were no clear guidelines as to how participants were treated in each of the 3 groups, and therefore the study was not performed in the appropriate manner as if all the participants received the sneakers that they were allocated to. There was between group comparisons. A statistical comparison was made between the groups, as evident with the confidence interval of each of the 3 groups. There were measures of variability that were satisfied by including the standard deviations for each 3 groups in the study. As the outcomes were categorical, the number of subjects in each category was given for each group, and therefore this criteria was satisfied. For the results, 622 participants were screened, stratified, and randomized. Variables such as past history of ankle sprains, subjective instability of the ankle, and physical examination findings such as foot type and range of motion were not predictive of ankle sprains during the study period. Group members who dropped out or were cancelled from the study did not differ from the overall population, except that a higher proportion were randomized to the high and low top basketball shoe groups. There were no obvious differences among the 3 groups. So 41 participants dropped out, 3 were disqualified from fighting, and 9 were cancelled from the study. This was a prospective randomized experimental design. It was over a period of 2 months. There were a total of 1,833 player games and approximately 39,302 minutes of player time. There was no significant difference among the 3 groups, leading to the conclusion that there is no strong relationship between shoe type and ankle sprains. Analysis of the group of 15 players showed no statistical difference compared with the study population as a whole. Using a Poisson distribution, the injury rates per groups display no significant difference. 15 ankle sprains occurred during the study period, 7 in high top shoes, 4 in low top shoes, and 4 in high top shoes with inflatable chambers, giving injury rates, so injuries per player and minute. A survival analysis was performed as a second test, and no significant difference in injury rates was found among the groups either. With the percentage of sprains, 72% of them were grade 1 sprains, grade 2 sprains were 21%, and 7% were grade 3. Other injuries occurring during the study period, there was 1 back contusion, 1 suspected meniscal injury, and 1 contusion described as the wind knocked out of him. 3 reported injuries among athletes wearing each type of shoe.
The benefits of this study were that the high-top shoes lace up around the ankle to provide extra support. They reduce pain and suffering of all basketball players, and they also save the costs of hospital bills and eliminate the risk of sprains and other permanent injuries. The reduction of these costs of the treatments, such as injury protection, pain relief, and control inflammation, gradual training, and the physio to strengthen ankle and calf muscles to restore back to normal function. For basketball players, these help to reduce the risk of rolling ankles with the quick, fast-paced change of direction throughout the game. They also provide lateral support of the ankle amongst the high shock absorption, and according to the Ottavia et al. 1995, it is stated that the high-top shoes are effective in restricting inversion and eversion movements of the ankle. The risks of these are that high-top shoes can be heavier than the low-top ones, which can reduce performance and consume more energy for the players. However, there is more risk to the players who wear low-top shoes than those with the high-top ones. These includes sprained ankles, torn ligaments, broken bones, permanent injury, ligament ruptures, avulsion fractures, and all of these can also lead to hip and knee problems. The costs of these, on average, adult basketball high-cut shoes cost between $60 to $250. 1 pair of these shoes can reduce the risk of injury, which is far less than the cost of the hospital and physio bills for treatment after an ankle sprain or injury. The study undertaken in 1983 in the US stated that the estimated expenditure for 2008 was $4.22 billion for the moderate to severe ankle sprains. Our group's recommendation is to continue high-cut shoes for ankle support during to reduce the risk of ankle sprains. The benefits of these also certainly outweigh the risks. It also saves costs on hospital bills, physio sessions, and support gear for the future as a result of ankle sprains and other treatments. If the cost of high-cut basketball shoes is a barrier, alternatives to reducing the risk of ankle sprains may also include purchasing protective lace-up ankle guards and braces. Thank you for listening.